Good evening, everyone, and welcome to tonight's webinar on bowel and bladder issues in MS. My name is Brian Thompson. I'm a programs manager for CanDo Multiple Sclerosis. I'm thrilled to introduce our two speakers tonight, occupational therapist Ann Mullinix and advanced practice nurse Marie Namey. So I'm going to first turn things over to Ann.
Hello, everyone. Greetings from snowy Minnesota. I have worked as an occupational therapist here for about 25 years, actually a little bit more than that. And back in the day, I worked with Dr. Randy Shapiro, and that's how I got involved in the Jimmy Huga Center, or now the CanDo Center. I also am an integrative health and well-being coach, and I am nationally board certified in this new profession. I'm excited to be here, and thank you for joining us. Marie?
Good evening, everyone. My name is Marie Namey. I'm an advanced practice nurse at the Mellon Center at the Cleveland Clinic in Cleveland, Ohio. Yesterday was my 34th anniversary being part of the Mellon Center here. And many, many years ago, I recognized the importance of symptom management for people who had multiple sclerosis because symptoms affect quality of life. And certainly the topic today, as you know, has multiple impact on everyone's quality of life. So I was very excited to be part of this seminar and hope we answer your questions as we go along and keep this interesting for you.
Okay, so our learning objectives include a lot of practical information with an intention to help each of you understand how MS causes bowel and bladder problems. It also is to affirm that you are not alone and how common these symptoms are for people with MS, and also to empower you to find the solutions you need to have a more satisfying quality of life. Now, we know you are a well-informed, savvy audience. For tonight's webinar, we invite each one of you to make an intention for yourself. Consider what specifically you want to change, improve, or learn, so that at the end of our webinar, you will be able to create a wellness plan that you need so you can be successful in your bowel and bladder management.
So when we review the literature, we have recognized that at least 60% of people who have multiple sclerosis may experience problems with bowel function. And this can occur at any time during the journey with multiple sclerosis. More people, about 80% of people who have MS have experienced problems with bladder function. Oftentimes you might hear clinicians say when individuals have difficulty walking, they almost always ask if there are problems with bowel and bladder because both of those functions stem from the spinal cord, which affects walking and affects bowel and bladder concerns. Symptoms can come and go. They can be intermittent. People may have symptoms that are bothersome for a while, or these symptoms may persist over time. As I said earlier, they can occur early on in the disease, early with diagnosis. Sometimes bladder problems are a presenting symptom with folks who have MS, or sometimes these symptoms continue and progress as the disease does. But what's most important here, and what we hope you'll take away from this seminar, is that there's many options for management of these symptoms.
Yeah, and Marie and I really want to make mention that these bowel and bladder symptoms are common, and if they are left unmanaged, these symptoms can interfere with daily activities and lead to feelings of anxiety, frustration, embarrassment, and sometimes withdrawal from meaningful activities. Now, that poll suggests that they interfere, but not significantly, which is great. But it's so important to be as proactive as you can in managing these problems. And if we offer just one takeaway for you today, Marie just mentioned it, but we want you to know that these problems can be managed. And by taking this proactive approach, you can help to avoid complications, maintain health, and improve your quality of life for you to be able to engage in the activities that give you purpose, enjoyment, and connection.
So let's take a look at these two important functions, bowel and bladder, and we can look at them from two perspectives. We can look at these symptoms in terms of an illness orientation, or we can look in terms of a wellness orientation. And certainly in my day-to-day practice, I hear many individuals talk about the problems with incontinence, difficulty with holding their urine, holding their bowels. Many people talk about having to restrict their fluids, not drinking many fluids during the day if they have an activity to do later at night. Certainly we know that urinary tract infections can occur in individuals with MS, mostly because fluids are restricted or people are unable to empty their bladder, and that residual urine can grow into an infection. We hear concerns about constipation or bowel irregularity. And then folks are very concerned about having that tube, that indwelling catheter, or having to use a catheter at all, which could affect their lifestyle. And then we all know of folks who use diapers and spend a lot of money, I must say, in using protective devices like a diaper. And some people choose to use medications on their own to try to help manage the symptoms. And that's more of a negative focus, what I just said. So let's flip it around and talk about a wellness orientation. So the goal would be continence. The goal would be to know when you have to go to the bathroom, get to the bathroom in time, do your business, and get out. We hope that people would have an adequate amount of fluids every day. Not only do you need fluids for your bladder and bowel, you need fluids to keep your skin turgor nice and smooth. You need it for the glossiness of your hair and just general well-being. There are many measures to prevent infections. One certainly would be to drink enough fluid so that the fluid in your bladder isn't sitting there over a long period of time, and that fluid is exchanged for other fluids as you drink throughout the day. Regular use of the bathroom for bowel movements is also a healthy and helpful wellness orientation. And whatever works for you. Some people get a diagnosis of MS and they have not had good bowel function as a child. And so we want for you the best you can do with the situation. We want medications to be used properly. There are many prescription medications and over-the-counter medications that might help, with the goal, again, of having control, that you're in charge, you're in control of bowel and bladder, and that you're not restricting activities or restricting what you do because of these symptoms.
Wonderfully said, Marie. Because to summarize, by taking a wellness orientation, you can take charge, regain a sense of control, and successfully manage bowel and bladder problems. We're going to talk to you about how to do this through lifestyle, habits, and partnering with your healthcare team.
So let's start by talking about bowel issues. You know, often when I've presented to patients and other healthcare providers about elimination issues, I start with bladder first. But in this particular instance, I thought it might be helpful to start with concerns about bowel first. And so let's talk about that. We can't separate completely bowel and bladder function, though, because, as you know, MS is a disease of the central nervous system, meaning the brain and the spinal cord. And it's both the brain and the spinal cord that disruption that occurs in MS that causes the symptoms. So if there are lesions in the brain or particular parts of the spinal cord that interrupt that nerve function, folks can potentially have problems with bowel and bladder. there's an area of the brain called the pontine micturition center, which is the signal in the brain that says, oh, gotta go. And then those nerve signals are sent down through the spinal cord into the exact muscles for the bowel and the bladder. Whether you have lesions in the area of the neck, that cervical area, or lesions in the lower part of the spine, they can affect how bowel and bladder work. Because all of those nerves ultimately interact with the nerves in the sacrum, which are the nerves that truly innervate bowel and bladder function. So it's a complex pathway, but nonetheless, we have recognized over the years that MS affects bowel and bladder function. As I said earlier, 50 to 60% of people who have MS have reported problems with bowels over time. We haven't really done a great job of identifying the exact percentage because a lot of clinicians, to be honest with you, don't even ask patients about bowel and bladder function. They may ask more about bowel function than bladder function, and so the references that we have are a little older. Most people who have MS report constipation as a primary symptom. Some people have involuntary bowel, meaning that they are not aware that their bowels are going to move quickly and they have accidents. Diarrhea can certainly occur, although persistent diarrhea is most likely caused by something else, maybe an infection, something more gastrointestinal, or perhaps a reaction to medications. Most people in general have flatulence, and it's certainly a symptom that people with MS also experience, but often don't talk about. And fecal impaction, meaning a hardened stool in that vault, that area of the rectum that holds the stool, can also be problematic. But constipation and involuntary bowel would be what I'd say are primary symptoms. Constipation occurring most often, involuntary bowel occurring not as often, but let me tell you, when folks have experienced problems of involuntary bowel, they remember that day almost as well as they remember the day they were diagnosed with MS. So the constipation is the result of a slow bowel. It could be the slow movement, that slow peristaltic activity when food comes down the esophagus into the stomach and starts moving around the intestines and finally gets down to the point of emptying. Constipation can also be the result of medications. Honestly, many of the medications we prescribe for other symptoms in MS can be drying or constipating. Many of you probably know that narcotic medication, many of the painkillers, can also be constipating because they dry out the stool as it's, or the waste product as it's passing along the intestines. Some folks who have MS have weak abdominal muscles, so they're not even able to push the stool when it gets down to the point of exiting the area. And certainly we know that if you're having some difficulty getting around, having trouble moving your legs, moving around, that impaired mobility can negatively impact the ability of that whole mechanism for the waste products to move along and get out of the system. So, symptoms related to constipation, there are many. People can have hard formed stool. I often hear that from patients. There can be a lot of flatulence, a feeling of rectal fullness that they just can't get comfortable in their front area or behind area. When we listen with a stethoscope over the lower part of the abdomen, we don't hear that movement, that peristaltic activity that should be there telling us that things are moving along. Sometimes you can even see an extended or a distended abdomen, kind of like an outpouching if a person has not had bowel movements in a while. Or you can actually feel it. It's called a palpable mass, that area is hard and not moving as well. And many patients have reported headaches. There's that complete body discomfort when they're constipated. Maybe they don't feel like eating. They have that sense of feeling fullness. Nausea and vomiting can also occur. And then, interestingly, diarrhea could happen. So if the stool is hard in the vault, the material that's trying to move out and move down doesn't really have as much chance to dry, and so it leaks out around that hardened stool. And also, not having regular bowel movements can lead to increased fatigue, a symptom that we know is very, very prevalent in people who have MS. So the goal is pretty simple: a comfortable bowel movement in an appropriate place. That's all we ask. So if bowel habits are once a day, that's great. If they're every other day, that's great. If it's every 2 or 3 days, that's okay. I honestly get nervous when bowels haven't moved in a longer period of time than that. But the goal is the comfortable bowel movement in an appropriate place. So here's some tips, very practical tips for trying to manage bowels. You need to eat regularly for regular bowel habits. Depending on what we eat allows us to have a bowel movement every day, every other day, or whatever the frequency is. And there are 3 important criteria, 3 important parts to having regular bowel movements. We need fluid, fiber, and activity to keep things moving around. The fiber holds on to the fluid and helps keep things moving along. So how much fluid do you need? Well, 48 to 64 ounces a day is what's recommended. So you think in your mind that's 1.5 to 2 quarts of fluid a day. It doesn't have to be water, but it needs to be beverages that are water-based, which is best, which most fluids are, and try to avoid medication or try to avoid fluids that might affect your bladder, which I'll talk about in a little bit, like those fluids that have caffeine in them. We also need 20 to 30 grams of fiber a day, which is what's been recommended. Men, interestingly, need more fiber than women. Well, how do you get fiber? So fiber comes in forms of fruits and vegetables and grains. And I truly prefer that people eat real food rather than eat a granola bar or take Metamucil or something like that. Fruits and vegetables and grains are the best natural source of fiber. And then try to work with your own body. Plan for a bowel movement about a half hour after a warm beverage or a warm meal is taken, because that's when that peristaltic activity is strongest. So if you get the urge, that feeling in your stomach to have a bowel movement, honor that urge and get to a bathroom. Stay in the bathroom for about 10 minutes, and if nothing happens, get out and try again later. So basically, here's some quick helpful hints. You need to take your time. My joke is haste does not make waste. You can't be rushing around trying to get the kids out or trying to get to work or trying to do things in a hurry. Your bowels need time. Meat doesn't have fiber. Again, fruits, vegetables, and grains are your source of fiber. And here's some good fiber. Cereal is a good source of fiber. Just 1/3 of a cup of Fiber One, All Bran, or Bran Buds can provide 10 to 12 grams of fiber, which, if you remember, is about half of what you need for the day. Some people say, oh, I can't eat cereal because I don't like milk. I'm lactose intolerant. Well, don't put milk. You can snack on these cereals. Put them in a little baggie, take 1/3 of a cup to work with you or when you're out and about, and just snack on them throughout the day. Greasy foods or spicy foods or food intolerances can cause loose stool. So if you're having loose bowel movements, keep a diary, keep track of what you have eaten, because it may make sense to you that eating a certain food, like Mexican food, can cause your bowels to go awry. And it takes time to develop bowel habits. Be patient. If it's been years that your bowels haven't worked well, or 6 months, it's going to take 3 or 4 or 6 weeks to get back the habits of a regular bowel movement.
And I'm going to piggyback off of Marie's helpful hints, because lifestyle behaviors are critical for successful bowel and bladder management. And she's already mentioned this, but I'm going to reinforce it again. Create a routine and stick with it. Attempt as much as possible to have a consistent schedule of when you eat and when you eliminate. Our minds and bodies love structure and predictability. A client recently told me that her diet is the cornerstone to living well with MS. And I believe the audience here tonight probably feels the same way. Yet we also understand it can be difficult to eat well and consume the fiber and fluid needed. Marie just gave some great examples of how to get fiber into your diet. Some other examples that some of my patients use are literally starting the day with a plan and writing it down in the calendar. Make an intention of when you're going to eat, what you're going to eat, schedule it in. Some of my patients set an alarm clock to remind them to drink fluid during the day. Others have what they call a power pantry. Have your pantry stocked with good quality whole grains. So when you're in that emergency, you're able to grab some supplies. And also, nutritional intake can be simple. It doesn't need to be complicated. Marie told you about how the most important foods for fiber are fruits, vegetables, and whole grains. And some examples of really good high fiber fruits are raspberries, pears, apples. For vegetables, green peas, broccoli. Whole grains, whole wheat spaghetti, quinoa, barley, bran, and legumes. Beans and lentils are excellent. Nuts are really good too. You know, another little hint, when you first wake up in the morning, have a glass of room temperature water with a little lemon squeezed in it. That can do a lot of nice work as you're working into your day for your bowels. Another real important lifestyle factor to consider is sleep. Just as our bodies respond positively to eating and elimination schedule, it is the same for sleep. Now, I know this could be opening up a big can of worms because people have challenges with their sleep. I get that. But just the more regular your patterns can be, it really does help with healthy bowel habits. So maybe think about, if you have difficulty with sleep, incorporate some good sleep hygiene so you can fall asleep and stay asleep. And some examples include limiting fluids within 2 hours of sleep, no screen time an hour before you go to sleep, and try some relaxation techniques. Movement, exercise. Marie said that this is so important, and I'm stressing it again. And I want to stress that exercise looks different to everyone. Doesn't mean you need to go out and run around the block. It could be just seated aerobics, swimming, walking, whatever it looks to you. Just move your body and it will move your bowels. Now, I want to take a little second here to talk about stress, because stress is big. And we want to consider, how is it playing a role in your bowel management? It does not help us get the job done. Our bodies freeze and go on survival mode. So you know what I want to do? Let's just pause a minute here. And I want to teach you an exercise. And it's the simplest form of stress management anyone can do, anywhere. And it's a breath exercise, breathing from your belly. And this exercise reminds us that we have a remarkable body that can be taught to relax, and at the same time, this exercise can strengthen abdominal and pelvic floor muscles. So let's quick try it. It will only take 30 seconds. So everyone put your hands on your stomach, seated, you're comfortable. And I want you to, as you inhale through your nose, imagine that your belly is a big balloon and that you're slowly filling it with air. Watch your hands rise when you inhale. And now watch your hands fall as you breathe out of your mouth, letting the air out of the balloon. So as you exhale, make sure your belly stays relaxed. Try this 1 or 2 more breaths. The next time you're sitting on the toilet, keep your attention on the rise and fall of your belly. Seriously, give it a go. It takes practice, but you can have remarkable turnarounds to just get more at peace. Lastly, I often tell my patients or clients to keep a journal. If you find that you're struggling with getting exercise in or really knowing what to eat, when to eat, you feel like you're out of balance, your sleep is out of balance, take a journal for a week and record when you eat, when you eliminate, when you sleep, whatever it is that you're trying to figure out. Because if you look at that week, once you write it down, it really helps to show some patterns and you can gain a lot of information from it. It also is really helpful for your healthcare provider to see, because then you can start tweezing out what needs to be done to get you back on track. Because as you know, lifestyle changes will positively impact other MS symptoms. It is all interconnected. You eat better, your bowel habits improve, you have more energy, you have less fatigue. You know, it's a win-win. So we can't stress enough how important and critical lifestyle behaviors are. Bree, back to you.
So, Ann, I agree. Lifestyle behaviors are so important. My attempt at humor is on this slide here. For those of you who are just listening in on the phone, there's a picture of a bottle of Phillips being poured into a cup, and it's called Milk of Amnesia. Take it in the morning, and by noon, you forget you were constipated. You don't really have to laugh at that, folks. All right, so let's move on to some treatments for involuntary bowel. Interestingly, the treatments for involuntary bowel are similar to those for folks who have constipation. Bowel training is very important. Try to keep a schedule of having your bowels move at regular intervals. And diet certainly plays a part in that. Eat regularly for regular bowel habits. The use of a glycerin or a medication suppository can also be helpful to regulate and move out the stool that is situated in the vault, because usually once the vault is emptied, there is no more stool that would come out. And your healthcare provider can help you with this particular technique, or sometimes your occupational therapist or physical therapist can help guide you along with this also. There are some medications that can be helpful for loose stool or involuntary bowel. These are prescription medications, and again, you need to talk to your healthcare provider about what might be best for you. So we've talked pretty much about some bowel issues. Let's move on and be more specific about bladder issues and what treatments are available. So typically when we talk about bladder disturbance in multiple sclerosis, we talk about a neurogenic bladder, nerve problem bladder. And we talk about inability to store, inability to empty. And when individuals have this type of problem, they have similar symptoms. Urgency. When you got to go, you got to go. You go frequently. You need to go to the bathroom often. Sometimes, if the person has inability to empty, they get to the bathroom, they try to empty, and they have to wait, or nothing may come out. Nocturia may also occur, meaning that people wake up more than once at night to go to the bathroom. Waking up once is pretty normal for individuals, but waking up more than once can be certainly so disruptive to sleep. Incontinence is a symptom we often hear about, leaking urine in small or large amounts. And as I talked about earlier, bladder infections can also be a concern. For the bladder to work properly, those bladder muscles have to work in coordination. The detrusor muscle, which is the muscle that says gotta go, and helps push the urine out, needs to work in perfect coordination with the sphincter, which is the gatekeeper at the lower portion of the bladder, to allow that urine to come out and then to close up when all the urine has emptied. And that's the reason that bladder disturbance can occur in MS, because there's not good coordination of those two muscle groups, or that the detrusor muscle is overactive, or that the sphincter is a little bit irregular in when it wants to open and close. So if a person is describing inability to store, meaning they can't hold urine, they go to the bathroom often, we hear that they limit fluid intake, because if you drink, then you got to run to the bathroom. Many people take frequent bathroom breaks, and they know where every bathroom is wherever they're going to go. Many individuals, particularly women, wear pads or protective undergarments. And I tell my women patients, women should not be spending money on protective undergarments if they don't have to. You should be spending your money on shoes and purses and things like that. An easy way to try to help your bladder work best is not to use as many fluids that are irritating to the bladder. Caffeine, caffeinated products, whether it be tea or coffee or Coca-Cola, Pepsi-Cola, Mountain Dew, all have caffeine. Aspartame, that fake sugar, can also cause our bladder to be irritated. And alcohol is another culprit. I didn't have it listed here on the slide, but smoking is also a bladder irritant. So another reason not to smoke. Oftentimes, your healthcare provider might suggest a medication. There are medications called anticholinergic or antimuscarinic agents. There's probably about 10 of them on the market now. They can help keep that detrusor muscle from being overactive. It's kind of a drying agent, so people can also develop a little bit of dry eye, a little bit of dry mouth, and this is the medication that can tend to make people a little more constipated.
I like your comment, Marie, where we should spend our money. I agree with that. That's a good one. Okay, everyone, the next series of slides look at daily living modifications, how your environment can assist with bowel and bladder management by considering your bathroom, different rooms in your home, and your clothing setup. Now, keep in mind that making simple adjustments can make a big impact on your bowel and bladder management. And I also want to make a point here by acknowledging that you, the audience, are the real experts here. As I'm talking the next series of slides, and a strategy that you have that works well for you that I haven't talked about, please share it with us. Submit your ideas in the area of the the questions where you submit questions. And then later, Brian will take a look at that and read some of your ideas to the rest of the group. So we would appreciate that because, again, you are the experts. So let's begin by looking at adaptive equipment. Adaptive equipment can be game changers. They increase safety, independence, efficiency, and reduce stress levels. As you can see in this slide, on the far left is a raised toilet seat. In the middle picture is a raised toilet seat with grab bars, and on the far right is a commode. These pieces do not need any special installation and can easily be removed. Some additional adaptive equipment that's very helpful in the bathroom are grab bars. The pictures of grab bars here are installed by someone who knows what they're doing and needs to go into the studs in the walls. So a handyman or a plumber or you handy people in the audience can do that too. I want to pause and also talk about positioning so you safely get to the toilet. You still need to get your business done, and you need to think about positioning can have a positive effect to help you out with this. So what I mean by that is, first of all, you need to make sure your feet are firmly on the ground. A lot of people that use elevated toilet seats may not have that ability to put your feet on the ground, so you may want to look at getting a step stool or use a phone book. So your feet need to be grounded. And also make sure you're sitting back as far as you can on the toilet seat because we want to encourage your knees to be higher up than your hips. So you have a angle at your hips. This helps. So what is going on is we're decreasing the angle between the rectum and the anus. And you're having gravity help you push a bowel movement out. So again, just play around a little bit with positioning to help you, you know what I mean, to get that business done. Additional things to consider, just simple, practical ideas. Keeping your bathroom well lit. And then on the left of the slide is a toilet tongue, and on the right is a spray bottle. And the idea behind this slide is just to say, you can maintain your independence by using, adaptive equipment. There's really a technique, a tool, or an adaptation for any toileting need. And occupational therapists and physical therapists are the sources to assist you with this if this is of need. And also, trying to get that slide to change there, you want to think about how your room or your home is arranged. Think about, do you have a clear path to your restroom? Be smart. Make as short of a distance as possible. Remove obstacles, clutter, such as throw rugs, piles of this and that. We all have it. But it sounds so straightforward and concrete, but it can make a big difference. Sometimes we have to get there fast. Make it easy for yourself. And also, for those of you who find getting to the bathroom is a struggle and a challenge at night, eliminate that component and bring the bathroom to you. Also think about, will that help the significant other who may also be in the room with you? Just some slight changes here and there can really make your daily life a lot easier. And lastly, just clothing. I'm sure this is a no-brainer for you all. You've figured this out through trial and error. But, the worst is you finally get there and you can't get your pants down, right? So don't add an extra challenge, especially, too, if you have some problems with your dexterity or your sensation. Use clothing that's modified, elastic waist, Velcro, magnets. There's so much out there nowadays that you can get anywhere practically that can make it easier for you to take off pants, to get on pants. Just make it easy. So I'm interested now to know what works for you Hey, Brian, did you get any ideas from our viewers?
Yeah, we're getting some comments coming in, and again, if you pop open your attendee questions, you can put your suggestions right into the inbox here, and we can learn from each other. So, the most common recommendation that people have had is the squatty potty, so having a stool to put your feet down and to elevate your knees. So, a few people have recommended that.
Excellent. Good to know, because I see a lot of that, and I've heard some people use it, so I appreciate that. Thanks.
And someone else says they attached a bidet to their toilet, so their slow or fast water spray aimed properly works great to help them with their bowel movements.
Excellent.
Hey, that's some couple great suggestions.
Thank you so much. Okay, back to you, Marie.
Well, these are all such great practical ideas. Let's talk a bit now about the other part of neurogenic bladder, about inability to empty. And this is where people feel that they need to go. They may go to the bathroom a bit, but they just don't always empty the contents of their bladder. And to treat this, again, adequate fluid intake is important to constantly exchange that fluid in the bladder to decrease the chance of bladder infections, of that old urine sitting there. Structured time voidings are important. What you used to do with your children when you raised them. You knew when it was time to go to the bathroom, and you took them to the bathroom. You need to plan ahead for yourself. About an hour and a half after we drink something, it moves from our mouth into our stomach, around into our kidneys, and down into our bladder. So about an hour and a half after you drink something, it's ready to come out in the bladder. And that's an average transit time. It might be an hour and 15 minutes for some. It might be an hour and 10 minutes for others. Intermittent catheterization is also a technique that can be used to discreetly empty the bladder using a little tube and gravity so that all the contents of the urine is emptied. Certainly the tips you just heard from Anne can be helpful. Good posture when you're on the toilet. I also suggest to men that they sit to empty rather than stand, because sometimes if your legs are wobbly, if you're having a little incoordination problem, you're having some problem with weakness, and you're worried about supporting yourself on your legs, that sphincter won't relax enough to let you empty your bladder. And then, of course, we always can pull out our prescription pad and order medications that are alpha blockers or antispasticity agents that kind of relax those different muscles within the bladder. So a couple hints here again. Adequate fluid intake, and you've heard me say this before for bowels, is 1.5 to 2 quarts of fluid a day. Water's best. Decaf tea or fruit juice is fine. The urge to void occurs about an hour and a half or maybe 2 hours after you drink something. And those culprits, like caffeine, aspartame, and alcohol, can irritate your bladder. Here it is that smoking's a bladder irritant. And if you limit fluids, that could be harmful to your overall health. So if you're going to drink, I suggest you drink your fluids all at once. Drink that 6 to 8 or 10 ounces within a 5 to 10 minute period of time. Because if you sip a little here, and 10 minutes later you sip a little there, and 10 minutes you sip a little there, you're constantly going to be feeling the urge to void as those little amounts trickle into your bladder and activate that detrusor muscle. You want to void about 1.5 hours after you drink. Stop drinking fluids about 2 hours before you go to bed so that you can empty your bladder right before you go to bed, and potentially avoid one nighttime trip to the bathroom. It really is not normal to leak urine, wake up more than once at night to go to the bathroom, or have frequent bladder infections. People who have MS should know that the symptoms of a bladder infection may not just be the burny, itchy, smelly urine. What might happen if you have a bladder infection is that your other MS symptoms get worse temporarily. Your fatigue may be worse. Your ability to walk may be worse. Your spasticity may be worse. Bladder infections have a negative impact on MS symptoms in general, and so it's very important that we identify them early and that you do get them treated. If bladder infections occur often, then probably a referral to a urologist would be recommended. So Anne has some information here.
Yeah, thanks, Marie. Now I'm going to shift again, and we've talked about how our home environment can assist with bowel and bladder management. And now let's look at how our community environment can support you and not hinder you by being prepared, familiar, and realistic. Again, viewers can submit strategies that work for them in the next series of slides while we talk about this. And then we can hear what people are doing in their lives to make it easier for them to be in the community. Be prepared, which also may mean to have a backup plan. You know, I have a feeling that really there is nothing new to you, the viewers, on this slide. You know, you all know you have a backup change of clothes, you wear added protection, you wear comfortable, easy to remove clothes, and you try to stick to your schedule as much as possible, scheduling your outings around your eating and elimination habits. But this is a real point I want to make. Really think about what is most important to you when you go out. Identify your priorities and be willing to make compromises. Be familiar with where you are going. This includes travel. You all have your favorite restaurants, movie theaters, grocery stores, etc. that you know that are easy to get around to. They're not as crowded. They have great bathrooms. But what about those places that you are going to but you haven't been to before? You will be more relaxed and comfortable doing a little research ahead of time to kind of get the lay of the land, to know what you're heading into. And when you're out, have a planned bathroom break. Schedule it in. Just do it. Even if you don't feel like you need to use it or not, schedule it in. Just get into that habit and predictability. And communicate with others that you're with. So don't assume that people know what your needs are. And remember, everyone poops and pees, and most likely has had a mishap of some of their own at some time. And be realistic. I'm not trying to sound preachy here because, you know, think about the expectations you have for yourself and others. You know, so often I hear from people, oh, it was a disaster, it was a letdown, it wasn't worth it, it's just not worth going out. But, you know, we know through research that staying connected to others, to life, is extremely important to our health. So just as you're thinking about what is most meaningful to you, again, think about what is most important to you about getting out and staying engaged. Be flexible. Use humor. And surround yourself with people who will support you and go with the flow with you. Before I go on, though, Marie, before we start talking, Brian, did we get any suggestions?
Yeah, we still have a lot of comments coming in, including from our last talk about modifications to bathrooms, and people really recommended vertical grab bars and heated toilet seats, and just in their home having doors open and removing clutter, so if an emergency does arrive, kind of planning ahead to have an easy route to the bathroom. As far as out in the community, people have really recommended, well, women have recommended having a dress or skirt to just make that easier, and a backup bag in their car with hand sanitizers and other things, so having that backup bag.
Great. Thank you, everyone. Great ideas. Okay, Marie, sorry about that.
Thank you. No, that's great because You know, CAN-DO recognize the importance of talking about bowel and bladder issues, and you and I, Ann, have certainly supported that. And I want patients to understand that if these are concerns, don't just let them go. Talk with your healthcare provider about these issues with bladder or bowel. And if they can't help you, request a referral to a specialist for treatment recommendations. You can see a urologist who specializes in bladder issues for men and women. A gastroenterologist may be helpful for bowel issues, or a pelvic floor specialist, someone who is potentially an OBGYN or a occupational or physical therapist may also help individuals with exercises to help strengthen that pelvic floor, that area of our body that helps support bowel and bladder function. So speak up, folks. Don't be shy. So some people have asked about Botox, and Botox has really been a very helpful intervention, so I thought I'd give it a moment of time here. This muscle relaxant is also very useful to treat bladder incontinence. With an overactive bladder, if that detrusor muscle is overactive, that bladder muscle contracts too often and without warning. And injections of Botox right into that wall of the bladder, into that muscle, can decrease that urgency and frequency and the need to void often, and also bouts of incontinence. Treatments are expensive, I might add, but often covered by insurance, and they need to be repeated every few months. You can try a treatment with Botox with a urologist and determine for yourself if it's beneficial or not. Sometimes, however, the bladder can't empty as well after the Botox treatment because, again, that Botox is a muscle relaxant, and what it does is allow more urine to be held in the bladder, so sometimes people need to learn how to catheterize to get out that urine that's still there. All right, Anne.
All right, everyone. As we are now coming down to our conclusion and the end of the webinar, we want to take a moment for you to identify one small change or addition that you want to make in your wellness plan. And I have pictures here of a kaleidoscope because the image of a kaleidoscope I think is great. As you know, a kaleidoscope, if you just turn it a little bit, a whole different picture is created. One small turn changes a big picture. And you know, that's the same with management of symptoms in bowel and bladder. Any tool, technique, or strategy that you add, and it's just one small move that you make, can better support your digestive health and in turn will positively change your whole health picture. So we really hope that you gained a lot of information from our talk today, and we have a lot of resources for you. Don't worry about writing these down because you will have all these resources plus more in an attachment that you'll be receiving from us. And we really appreciate your attendance. So now it's time. We have a good 15 minutes here for some questions.
Yes, excellent. Thank you, first of all, so much to Anne and Marie for all that great knowledge and practical tips on really two tough topics, and for everyone that provided their suggestions as well as their questions. So we'll try to get to as many questions as we can this evening. If we don't get to your questions, I'll let you know about another opportunity to submit questions to CAN-DO MS, and we'll try to get you answers. So we had a couple people that went to a urologist, and they were referred to either a physical therapist or a physiotherapist, but they're not really sure what that entails. Could you talk a little bit about what physical therapy could do to help with bowel and bladder issues and kind of training those areas of your body and to improve function?
Yeah, should I take that, Marie?
Go ahead.
Why don't I take it and then you add to it too? So a physical therapist Marie referred to this a few slides ago with being a pelvic floor specialist. And it usually is a physical therapist, and it can be an occupational therapist or a physician, a physiatrist can do it too. But what they have a specialty in is working with strengthening the pelvic floor muscles, as Marie stated. But they use different techniques. They use manual therapy, biofeedback, electrical stimulation. They look at positioning and different exercises. So it's a whole slew of activities that they have the ability to really work on strengthening that area to help controlling your bladder and incontinence, and as well as helping with bowel function. Marie, do you want to add anything to that?
Well, I would just like to say that this is a very specialized area. The therapist can help you identify these muscles. I mean, we all have them, but sometimes you just don't know that they're there. And once you identify them, you can work to strengthen them and utilize them to your best benefit.
Excellent, right.
Great, thank you so much for that. We also received a lot of questions about UTIs, and some of them are caused by catheters. Some are they feel it's just part of their MS. Can you talk a little bit about those types of infections and some tips to help avoid them?
So bladder infections are common in individuals who have MS, either because they have not emptied their bladder completely, and as I said, urine being a waste product sits in that dark, moist environment and more bacteria grow. If individuals have an indwelling catheter or a suprapubic catheter, that's a piece of rubber or plastic in a body part. And sometimes bacteria will colonize around that area because it's a foreign object in your body. This may or may not cause a true bladder infection. A true bladder infection generally causes some types of symptoms. If we just look at the numbers in a bladder, in a urine specimen, sometimes we get fooled in thinking that, a person has an infection, but really what it is the response of the body to having that piece of foreign object inside. If individuals are using indwelling catheters or suprapubic catheters, they need to be changed at least every 4 weeks. Some individuals need to have the catheters changed more often. But again, that's something to discuss with your healthcare provider to see what would best help you. Some people are more sensitive to other materials than others. Some people need a latex-free device rather than a catheter that is made primarily of latex. So there's without a one-on-one with some individuals, I can't really make give you a definite answer to that question. That's just some general information. But certainly if symptoms of MS change or get worse, and there's some concern about urine, we should check the urine and see if there's any bacteria growing.
Great, thank you, Marie. And you mentioned a lot of community modifications. We received a lot of questions specifically surrounding travel, so long flights and long car rides. What are some good coping strategies for dealing with urinary symptoms while traveling?
Yeah, those are really good questions, and they're tough. If you're in that air, make sure you sit on the aisle seat and closer to the bathroom. Know that we don't always like to sit in those areas, but it will make it a lot easier for you. And protective pants. If you're in a situation where you're just unsure that you're going to be able to get to the bathroom and use it in the amount of time that you need, I would just have a backup plan with some protective pants on, just in case, because that's going to give you a peace of mind to do that as well. Now, traveling too, fluids. You got to balance this out because you want to be drinking some fluids when you're in the air for a long time, and you don't want to become dehydrated. But remember how Marie said, drink all at one time? I think that would be a much better suggestion than doing sips slowly throughout the flight. Drink at one period of time, and then you know that you're going to have to go use the bathroom within the hour after you drink, an hour or two after you drink. So try to keep yourself on a schedule as much as you can when you travel. Traveling in the car is just making more frequent stops. Kind of the same thing with the fluid intake, planning it out ahead, and just being as flexible as you can. You know, travel is really important, and what people do the most is just to be as prepared as possible, knowing where you're going, plot out a route, just do that extra step of being a little bit more organized and forefront in planning it, and then it should go a lot smoother for yourself. Marie, do you want to add anything to that?
You've covered that topic so well, and being prepared is, that old Boy Scout motto is so important. And people need to be hydrated if they're traveling, particularly on airplanes. Water is best. Drink the water. You know, if Coke is going to make you go to the bathroom more urgently and frequently. Any other fluids other than water may play havoc with your bladder. So drink your fluid, time out your bladder time, and do the best you can getting to the bathroom.
It's great advice. We received a lot of questions about Botox and steroid injections, and Marie, I know that you touched upon this in one of your slides, but I was seeing if you go in a little more detail of exactly what does Botox manage. Does it help with an overactive bladder, or a little bit about what that entails?
So if a person has inability to store and are leaking urine because of that, they are the best candidate for Botox. But it would really depend on the urologist and their evaluation. So a person would need to see a urologist, and they would be evaluated by the urologist. They would do some testing as to how the bladder is working, and then make a decision about whether or not Botox might be helpful. Botox isn't given on the first visit with the urologist. That would be like on a second visit after that full evaluation is completed. It's important to know really how those muscles are working, because symptoms of inability to empty, trouble with an overactive bladder, or inability to store, if they have inability to store, which is an overactive bladder, inability to empty, are very similar. And so some specific testing may need to be done, like having a person void on their own and then do an ultrasound of the bladder to see if any urine is left over. They may do more sophisticated tests like a cystoscopy, looking actually in with a scope to see how the bladder is working. They may do urodynamic testing, which is even more sophisticated, to look to see how the bladder fills and then how the bladder empties. So it's a multi-step process if a person is interested in Botox for their bladder, but mostly it's utilized for overactive bladders.
Great. Thank you for going into more detail on that. Similarly, you talked a lot about nutrition, and we got some specific questions following up to that, ranging from, does dairy help? Does cranberry juice, probiotics? Any other details about nutrition, either things that can help our bladder and bowel health or that can be irritants?
So I'll start a little bit, and please add in. So I'm plus minus on dairy. Some people may be lactose intolerant. I'm amazed to see how as we age, sometimes people develop lactose intolerance, and they can't do dairy. Cranberry, you specifically asked about, can be beneficial for bladder if people are having bladder infections, because cranberry juice or cranberry pills can change the pH or the acidity of the bladder. You want the urine to be more in an acid mode so that bacteria doesn't grow. It doesn't have that environment to grow. Interestingly, if people drink orange juice or grapefruit juice, which start off as acid, they end up being more alkaline in the bladder, so they're not a helpful beverage. So cranberry juice or cranberry pills may be helpful. Probiotics have been recommended by some gastroenterologists to help with regularity of bowels, to, again, keep that activity going, to keep that gut activity going. And, again, you may want to talk to a dietitian or talk to another healthcare provider about what probiotics and how much might be helpful for you.
Yeah, I
Great.
have nothing to add to that, Marie. That was good. And also,
great.
functional nutritionists are good too. A dietitian or a functional nutritionist to look at your whole health of your diet, because food is medicine. And Marie made a great point earlier that instead of eating a granola bar, it's really more beneficial to eat real food. So substitution is fine. We have to do it out of convenience. We get that. But food has so much power for healing and to help with so many symptoms. So if you feel like that's an area that you are struggling with, as Marie said, a dietitian or a functional nutritionist could really be of benefit.
That's great. Thank you. I think we have time for one more question, and we have a lot of support partners that watch and listen to these webinars. And so the question is, what can a spouse or someone do to help with bowel and bladder issues, specifically to be preemptive rather than reactionary? So any tips to the support partners out there?
Anne, do you want to start?
No, you start, Mary.
Oh. All right. I love that question because it tells me that care partners want to be supportive, and you're the other heroes on this journey. So thank you for asking that. I think any encouragement that you can provide, any reminders of how to stay healthy. You did it with your kids. Keep a calendar on the wall. And you can mark, was today a good bowel day or not a good bowel day or not a bowel day at all, and monitor how often a person goes to the bathroom depending on what they drink and what the intervals are, and be available to assist is really great.
Yeah, communication is key. So if you're questioning what you can do too, make sure you ask your partner. Keep the dialogue moving, always open. And also, the diet the way of eating, the word diet sometimes can be misleading, but the way we're speaking about for people to eat with the fiber and the fluids is really how we all need to be eating. So this is a great opportunity for caregivers, for significant others to partner and eat the same way, be a team, explore different foods, try to have the mealtime together, because we all need to be eating this way, really.
Well, thank you again so much, Anne and Marie, for your time and for all your work into tonight's presentation. We hope that everyone found it useful and relevant. We have over 1,000 people joining us tonight between online and calling in, so clearly this is an issue that is important to people and resonates, and so we really appreciate you being proactive and showing the initiative in joining us tonight.